Here is your ultimate guide to Medicare 2023. Hey, this is Dr. Ed Weir, retired district manager of the Social Security Administration. Me and my team of retired Social Security employees help people throughout the country with all things Social Security and Medicare. So give us a call if you have any issues, questions, need something to help you with. Medicare Part A covers inpatient hospital, skilled nursing facility, hospice, inpatient rehabilitation, and some home health services. About 99% of Medicare beneficiaries don't have to pay Part A premium since they have at least 40 quarters of Medicare covered employment. The Medicare Part A inpatient hospital deductible, once you're admitted to the hospital, will be $1,600 in 2023, which is an increase of $44 from 2022. The Part A inpatient hospital deductible covers beneficiaries' share of costs for the first 60 days of Medicare-covered inpatient hospital care in a benefit period. In 2023, beneficiaries must pay a coinsurance amount of $400 per day for days 61 through 90. For beneficiaries in skilled nursing facilities, the daily coinsurance for days 21 through 100 of extended care services in a benefit period will be $200. So what about Medicare Part B? Well, what does that cover? Medicare Part B covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and certain other medical and health services not covered by Medicare Part A. So each year, the Medicare Part B premium, deductible, and coinsurance rates are determined according to the Social Security Act. And the standard monthly premium for Medicare Part B for 2023, $164.90, which is a decrease from $5.20. Last year in 2022, it was $170.10. So again, Medicare Part B premium, $164.90. Most people pay that unless they have higher incomes. The annual deductible for all Medicare Part B beneficiaries is $226 in 2023, a decrease of $7. And of course, just as last year and every year, Part B only covers 80% of covered services. So this is where a lot of people decide to look at other forms of coverage, including Medicare Advantage plans and Medicare Supplement plans, also called Medigap plans. If you need help looking for a Medicare Advantage plan or a Medicare Supplement plan or a Part D prescription drug plan in your particular area, make sure you give us a call. We help people throughout the country navigate Medicare and make sure they get the best plan for them. All our help is always free. So Medicare Part B premium of $164.90. So there is help out there for people that can't afford to pay for your Part B premium. A program called Medicare Savings Program. And basically those are administered by each particular state through your welfare office, Medicaid office. So all you have to do is contact your Medicaid or welfare office, or in California, it's Medi-Cal. Contact them, and if you're low income, low resource, and you meet the requirements, apply, and hopefully the state will cover your Part B premium. Plus, depending on your level of approval, they just might cover a lot of your other costs, co-insurance and co-payments and all the rest of it. And millions of people across the country receive this extra support. But the unfortunate thing is only about half of the people eligible have actually applied. So of the millions of people out there that are receiving the support, there's another half of those that unfortunately haven't applied. Make sure you reach out to your Medicaid office, your Medi-Cal office, your welfare office, or give us a call. Again, we are retired Social Security Administration employees, but we worked hand in hand with Medicaid offices, so we're familiar with that process as well, and we can guide you through the entire application process and make sure you get everything you're entitled to. And this does not only include Part B. Say, for instance, that if not worked enough to qualify for Part A, or one of your spouse or your ex-spouse did not qualify for Part A, you did not qualify for Part A based on a spousal claim or an ex-spouse claim, then you can request your Medicaid, Medi-Cal, Medicaid welfare office to also pay for your Part A. And basically what it is the states have determined, they've got their accountants there, and they say, well, we could pay for this person's medical bills. So if this person has been in the hospital for a long time, goes to the office, the hospital quite often, they can say, okay, this person has, $30,000 of bills every year. We can pay that, or we can pay this person's Part A premium, and therefore the federal government has to go ahead and pay it under Medicare. So obviously it behooves the states to get you Part A when you're on Medicaid. So again, reach out to the state or give us a call, and we can help you go through the process and see if they'll pay for Part A, Part B, obviously prescription drug plans. There's also a program through Social Security called Extra Help with Prescription Drugs. Give us a call. I've taken hundreds of thousands of those applications. We can walk you through the entire process. Probably one of the easiest applications in Social Security. All Social Security applications are pretty difficult, but the Extra Help for Prescription Drugs is pretty easy. But give us a call and we can walk you through the entire process. If you like the information I'm providing, please make sure you subscribe so you can keep up to date with all things Social Security and Medicare. We are doing videos on a regular basis based on our decades of experience, inside experience at Social Security, and hopefully watching a video and save you some money. So if you need help with all parts of Medicare, that is Part A, the hospital insurance, Part B, the medical insurance, Part C, which are Medicare Advantage plans. Those are run by private companies throughout the United States, and we are contracted with the largest Medicare insurance companies in the country. So if you need any help finding the best plan for you, definitely reach out to us. Again, our help is always free. We get, just as every other agent broker in the country, we get paid directly from the insurance company. It doesn't matter which insurance company you choose, whichever one is the best for you, doesn't matter. So, but to give us a call, again, there's no cost for you. And then there's Part D, the prescription drug plans. And again, those are also private plans. And if you need help finding a prescription drug plan, give us a call and we can find the best plan for you and enroll you. So again, Part A is you enroll with the Social Security Administration when you're 65 years old, or if you're on disability for 24 months or end-stage renal disease. Same thing with Part B. But with Part B, because there's a premium, some people choose not to enroll in Part B if they're still working and they work for a company that has 20 employees or more, or their spouse works for a company through current employment and they have health insurance through that current employment. So again, give us a call and we can walk you through the entire process. We've taken hundreds of thousands of Medicare claims, enrolled people, helped people out, told them, well, you don't need to waste money because you're currently receiving health insurance. And if you like your current health insurance, then go ahead and keep it. Maybe, apply for Part A and then come back in a few years once you stop working or once your spouse stops working, and then you can sign up for Part B at that time. Again, so if you are signed up for Part A and Part B, there is that deductibles and co-payments, and there's gaps in there, particularly the 20% gap for Part B of Medicare. So that's why people include Part C, the Medicare Advantage plans, or Medicare Supplement plans, also called Medigap plans. And we can help people. We're contracted with, again, the largest Medicare insurance companies, not only for Medicare Advantage, but Medicare Supplement. So we can walk you through that entire process as well. So Medicare Part C, Part D, and the Medicare Supplement, Medicare Medigap plans, those Social Security employees can't help you out with. Actually, they are barred from talking to you about those because they are private companies. So they can't make any recommendations one way or the other, even though Social Security employees kind of know, which plans people like and which ones are the best and recommendations, but they can't tell you unless, of course, they're retired. So that's why our experience and expertise in this field, lasting several decades, is our clients have found indispensable. And again, one of the services that we provide our clients that, from what we've seen so far, no other agent or agency in the country can provide is our vast decades of experience and expertise in all things Social Security. So with us, we just don't sign you up for a Medicare Advantage plan or a prescription drug plan or a Medicare supplement plan and then just forget about you or send you a birthday card or an email. Because of our experience and expertise, we're able to help you 365 days of the year, but not only you, your family, friends, next door neighbors. So as long as we're the ones that helped you enroll in one of those plans, C, D, or the Medicare supplement plans, then you are part of our family. And if you have a brother, sister, next door neighbor, son, daughter that needs help with Social Security, survivor benefits, disability benefits, filing for retirement, early retirement, and Medicare, whatever the case may be, just tell them to give us a call and we walk them through the entire process and we will help them out. So that is the service we provide that no other agent or agency in the country can provide based on decades of inside experience and expertise. And click the little like button so YouTube will send this video out to more people. And make sure you comment. Let us know if you had any good or bad experiences at your local Social Security office. Let us know. We still have a lot of people from Social Security contacting us. And we've also noticed that Social Security headquarters employees have been reviewing our videos and comments. And so if you have any good or bad comments or suggestions, make sure you put it in the comments there. And that way we can take a look at it. But also the people that can make changes are currently political leaders and the bureaucrats up there. They will take a look and see if there's anything they need to address. So make sure you click like, subscribe, and comment.